Hi, my name is Dr. Bre Patel. Today, I'm recording a short video to explain how to use a Waterpik. First, I'll go over on how to prepare the Waterpik so you can use it. Then, I'll go over what are the specific techniques so you can get the best results, especially if you have lots of crowns, bridges, or implants in your mouth. And then, I'll show you what are additional steps you can take in order to maximize the Waterpik's use. Let's go over on how to get your Waterpik set up so you can use it. Is pick out the right tip. The generic tip is this. It's nice for people who just have not many restorations or not many crowns, bridges, or braces, but this is a nice generic tip that could do everything, and it shoots up to a fine stream of water. My second favorite tip is this one. This is more for getting in tighter areas. This is specifically the orthodontic tip. So if you have braces, this would be perfect to remove plaque and debris around it. I personally like this one when it comes to implants or going underneath the bridges or crowns to get the plaque out. So once you identify which tip you want to use, stick with that one. Then you want to take your Waterpik. You want to fill up the reservoir with warm water, and then on the wand, you want to take the tip and slowly just slide it in. There's a little click there. And to remove it, there's a small button right there, which you can just push up and it comes right back out. Again, just to push it in, clicks a nice click, and it's ready to go. Then what you want to do is make sure that unit is plugged in. Then slowly turn the Waterpik on from 0 to 1, and then turn the wand on. Now, this will release the water, so it's better if you do it in the shower or in the bathroom if you're not prepared. And then if you want to turn it off, you can just slowly turn it off. Now, let's go over some techniques on how to best use your Waterpik. So now let's talk about the specific technique. So if you have a bridge or you have an implant, what's the best way to clean so you can prevent other things from starting, such as cavities or gum breakdown? So let's take this model where this patient has a bridge. You can see there's a 3-unit bridge and it's like this. So what's gonna happen is usually when patients eat, the food gets caught right in between right here, and it starts aggregating around here and here. And you'll also get plaque buildup around the gum line right there, right here, as well as in the posterior, in the back of the tooth, right by the tongue side. So what's the best way to go about cleaning that? What I would suggest is take your Waterpik, then hold the tip at a 90-degree angle like this, and then just come up a little bit more. So it's a little bit less than 90, but more than 45. So it's as if the water that's coming out of the Waterpik is going straight into the gums. So for example, if the Waterpik water was on, it would go right here, and I would slowly trace the gum line. I would go from here to here, here to here, here to here. And then I would repeat the process for the area in the back. Basically, I'm making U's or W's in the lower mouth, and I'm making M's on the top. So if it was like this, I would go like that. Right? Now, that will remove all the plaque buildup by the gum line, but what about the area underneath? You want to take the Waterpik and put the water stream right underneath the gums, right underneath the tooth, so that way it can flush out anything that's been caught. And you want to repeat this process for all your teeth. But now, what if you have implants? Well, with implants, it's pretty similar. You have to do the same thing. For example, here, this patient has implants right here, and then there is a 3-unit bridge. You do the same thing. You take the tip and you trace the gum line at a little bit less than a 90-degree angle, as if you're shooting the water into the gums. And then you're slowly following from one tooth to another, and you keep on going until you reach the other side, and then follow back in the posterior region by the tongue side or the palate side to get the back of the teeth. And this will remove majority of the plaque buildup that's around your implants or your bridge or your braces. Now, you're gonna be shooting water inside your mouth. Now, we could make it a little bit more effective. You could mix the water with something like ioConcentrate. This is basically a mouth rinse made for the Waterpik, but it comes in a concentrated form, so you can just put a little bit inside the reservoir, have it mix. There's actually a line inside the cap that you could measure up to. You could fill it up to the cap, then put it in the reservoir for it to mix, and then start using your Waterpik to further irrigate your gums underneath the bridge or the crowns or around the implants. And what does this do? This is a great natural and holistic way to remove plaque. It doesn't use alcohol. It uses iodine to remove that. Iodine is a natural antiseptic. In fact, our bodies use it to create the thyroid hormone. But in this case, we're using it to remove plaque buildup and reduce inflammation instead of something that has lots of alcohol, which wipes out all the good and the bad bacteria. So I would recommend using the iorinse with the Waterpik to get the best results for your gums.